This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new edition of Behind the Headlines. I'm Charlie Greenawalt, Senior Fellow of the Susquehanna Valley Center for Public Policy. And on this particular edition, I'm joined by my normal co-host, Maura Donnelly. Welcome back, Maura.
Normal?
Well, we each of us missed a few shows
We've been very busy.
Yes, it's nice to be together again. So, in the summertime, what do most parents and households spend a lot of time thinking about? It seems to be
usually vacation.
A vacation and education.
And education.
Education. Yeah. And so we have a budget that's pending. Mm-hmm. The governor's budget is pending in the state legislature, and it has a proposal for no increase in funding for the state universities and colleges. So we have someone here to talk about that, and that is Steve Hicks. Welcome, Steve.
Hi, Charlie.
It's nice to have you on the show again. Of course, Steve is the president of APSCUF, the faculty union that represents all the faculty for the 14 state system universities. Steve, what is your thought about the governor's budget, which proposes level funding for the 14 state universities? What effect will this have on higher education?
Well, yeah, as you know, Charlie, because you run a show like this one, budget season is kind of the local game in town, and it's a lot of fun from the governor's address in February till whenever they get finished. Under the Republicans and Governor Corbett, they've been done by July 1 each of the last 2 years, but it's always fun to see the ebbs and flows. You pointed out that there was an agreement for flat funding this year. 4 days before the governor's press conference or his speech given the budget proposal, he had a press conference with the higher ed leaders where they committed to keeping tuition as low as possible in exchange for the flat funding you're talking about, which for the state system is about $418 million. But that's, a loss of $90 million from 2 years ago when we took a big cut in Corbett's first budget. And that's been really damaging, I think, to the system and to households across the state system.
Were you at that press conference?
No, I was actually negotiating a contract at the time, Charlie. But thanks for asking. Yeah, I missed that one.
I wondered if APSCUF had been part of that or not.
No, but we talked ahead of time about the fact it was happening and what was discussed. So we were aware it was going on and the kind of deal that was made. But I think what people have to realize is that flat funding really is a move back. I mean, it's not keeping up with inflation. It's not keeping up with the expenses that the universities are incurring. And what that means in terms of your opening point, in terms of students and their families, there is going to be a tuition increase this summer. Don't know exactly what it will be. Obviously, it's a very soft commitment, as low as possible, and there will be jockeying among the various institutions. And of course, the governor sits on the board of Penn State, so he probably has quite a bit of say. You would think about what Penn State will do, and everybody will kind of pay attention to where the benchmark is lowest as possible.
And with elections coming up, you think they'll want to keep any potential tuition increase somewhat as low as possible. Would that be fair?
It's always true that they like to keep tuition as low as possible. They like that headline. They like to be out there looking like they're managing the money well and being careful about people's pocketbooks. But we're down to the point where the state appropriation only covers 26% of PASHI's budget. It used to be 66% when we started 30 years ago. So it was, it's been a big decrease. And this last decade hasn't helped. Obviously, the $90 million that were cut 2 years ago have hurt. And we can see that several different places. There's a study out that shows that currently it's 17% of median income is used to pay for a PASHI education, which, that's a pretty big slice of your family around the table pie out of your checkbook. The other thing is our students borrow somewhere in the neighborhood of $26,000 by the time they graduate. So those are huge numbers too. And the part of it that's a little disturbing from the sidelines is that this really doesn't have to be this way. It's a matter of priorities. Yesterday, the House Democrats came out with a proposal that would add $30 million to our line item, and I haven't studied all the line items, but I understand they prioritize differently than the governor did. But one of the issues is the income, and there are a lot of pieces of income that have been left on the table under this administration and this legislature.
Are you talking about the families'
I'm
incomes?
I'm talking about things like capital, stock and franchise
there you
tax, Delaware loophole.
Income to the state.
To the
Revenue
state,
to the state. Okay.
because that's the squeeze, is they don't think they have enough income to keep up with inflation in terms of our budget. So
We just made a good point that just because the governor has proposed it doesn't mean that is what's going to actually end up happening. In addition to what's happening in the House, are you seeing any movement for some potential increase in funding in the Senate or any other proposals that might be helpful?
I think we've spent most of the spring worried about the other direction. The governor's proposal in February, for lack of a better term, created linkages with various things like liquor store privatization, the transportation bill, and pension.
Everything's being linked
funding.
together.
Right.
At the opening, you said it was game time, and I think
Well,
that's
that's
what starts to
part of
happen.
that's why
Part
it's
of the
so
game,
fun to
yeah.
watch, is to see everybody juggle. To balance the governor's proposed budget, he brought in like $150 million from the pension reforms that he proposed.
Okay.
So we were worried that if they came up short and didn't do that our funding might be cut some more. And the income numbers in the state haven't been good. If you follow the monthly numbers, they've been behind the projections and behind the governor's projections for the year. So they don't think they're going to be in as good a shape at the end of this year as they thought they would be. So we've been worried about a cut. I think what the House Democrats did yesterday indicates that there are ways to rethink how we're doing things. And I think that goes back to the opening question. What is higher ed like, and where is it prioritized at this point? Right now, I'm happy that flat funding is what's on the table, because that's a positive against some other agencies. But in terms of actually running the system, that's not a great way to go. I mean, you can't run less than inflation in terms of your income, or you're going to be in a hole. And we've got about 900 positions they haven't filled at this point, and they've cut about 150 programs. They put on moratorium in the last 3 years. So
150 programs in the state system have been cut, and 900 positions are for teaching staff are being frozen.
I think that's everybody, Charlie. I think that's management and
faculty.
Management
And faculty.
Right.
Okay. Fair enough.
But they do, they jostle like that because they don't have the budget to keep them filled all the time. If there's an opening, well, let's go 6 months without filling it, because if we do that, that saves us that much money. So there's a lot of that going on, and a lot of people covering two jobs, or jobs not being done at this point because we've been underfunded for years. So it's a big issue.
This time of year, while the main focus is always on the budget, there's all kinds of other legislation that's floating out there. Right. What else are you taking a look at that's grant related, and there's some other programs you're interested in?
I think one of the things we've been concerned about is pension legislation, and I'm not going to talk a lot about that because you have lots of other experts on that topic, I'm sure. But clearly, that's a big one for our members, and a major change in how pension is handled in the Commonwealth would, maybe change the nature of recruiting our faculty, or maybe even keeping our faculty. The biggest piece directly aimed at higher ed are pieces of legislation that talk about distance education. Particularly, there's one in the Senate that wants to change the FIA policies on distance education and how much it's funded. Currently, there's a policy that says that you have to take at least half of your classes in person to receive FIA funding, and it would change that policy. I think this is a concern, should be a concern to everybody, because even as distance ed is part of the landscape of education these days across the country, there are problems with distance education in that almost every study and broad longitudinal studies indicate that there is less of a retention rate, lower grades, And that leads to problems down the road in an age where we're trying to maximize retention and maximize graduation rates. To do more distance education without being really careful about it is problematic. It is a great opportunity to get out there to places where people can't get to a campus. It's great for people who have jobs who want to sit down and do asynchronous work, and that can be very helpful, but it's really not a great replacement for face-to-face. And our worry about the legislation is it's going to spread the FIA dollars a lot thinner than they already have been spread. I mentioned $26,000 in debt indicates FIA grants really aren't as large as they could be to help lower and middle income families. And I think that would be interesting to see the legislation pass, if only to see the possible negative effects it has on the total grant program, because I think you'd be giving more grants and spreading their pie, which isn't growing, to many more people.
Steve, one of the things that's going on this summer is the hiring of a new chancellor for the state system. How's that process going? What kind of qualities or traits do you think should be found in a new chancellor, and how would you evaluate some of the? We have only had 3 chancellors in the history of the state system. Give us a quick thumbnail sketch of this process, would you?
Well, Charlie, you stole one of my talking points there. There have only been 3 chancellors in the 30-year history of the state system. And I think you can learn a little bit about where the system is and how it's progressed by looking at the 3 of them. Our first chancellor was Dr. McCormick, who was president of Bloomsburg before becoming chancellor. So he was an internal, homegrown person who understood the system from the inside. And he spent 20 years with the system and essentially retired from the system in the early aughts. And he brought that kind of, feel for the system and its roots in at the university level. And I think that was a big positive, and a lot of us look back as positive years. In 2001, Dr. Judy Hampel came from the Florida state system, and it was from the system office, and she'd worked in the system office. And I think it's telling to think back that we brought in somebody from a system office, because one of the things Dr. Hampel seemed to want to do is centralize the 14 much more than they had been, to create, instead of 14 Confederate universities, to create one big system that, if for lack of a better metaphor here, it's like Penn State. It has so many campuses, but it has a single identity. Probably her biggest claim to fame was she brought with her the notion of performance indicators. And they've been quite, as Charlie knows, as a faculty member, they're quite controversial on campuses because of the choices made and the fact that the initial set that her group put together pitted the 14 campuses against each other in competition for the dollars that were pooled. So it was a zero-sum game. If IUP did well, somebody on the other side was not going to do well, and vice versa.
What did the most recent chancellor bring?
Chancellor Kavanaugh came from Florida too, but he was a university president, and he was used to working with the legislature to get funding. So I think he brought some political acumen. To answer your question, what we would want, I think we want somebody who's out there publicly more pitching higher education. He didn't want to be the public face of public higher education in Pennsylvania as much as we would have liked, I think. And I think we'd really like to see the next person be out there saying how important higher ed is to the Commonwealth of Pennsylvania.
I think that's a good summary, Maura, and I think that you, Steve, have become the face of state higher education in Pennsylvania.
It's nice to say. Thank you.
You're quite welcome. We'll be back with the second segment of Behind the Headlines right after this.
Behind the Headlines is brought to you as a public service by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The Council works aggressively to define key long-term policy strategies and solutions that make the Commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Underwriters of America, a better way for truck insurance, and by Penn Waste, your best local choice for your waste removal and recycling needs.
Hi, welcome back to the second segment of Behind the Headlines. In this particular segment, Mara and I are joined by Andy Carter. Andy, welcome to the show.
Thanks.
Andy, of course, is the president of the Pennsylvania Hospital and Healthcare Association of Pennsylvania. And you were on a few months ago with us when you first came. Mara, why don't you start out?
Well, we're right into the middle of budget season here in Pennsylvania, so welcome to your first budget.
Thank you, Maura.
We wish everybody the best of luck when they encounter their first one. But give us some idea of what your top goals and priorities are going to be as you're into the middle of your first budget here.
Oh, thank you, Maura. It's an exciting opportunity to really bring forward to the General Assembly and the Governor's Office three key things that we want to accomplish. We want to see Medicaid expand, and second, we want to make sure that financial support through Medicaid for hospitals remains stable, and third, we want to make sure that access to health care in our rural communities remains as strong as it can. So those are our three top priorities for the budget.
Okay, so let's talk a little bit about the Medicaid expansion. Are you at odds with a few people on that particular issue?
Well, it's not been easy for Pennsylvania to reach solid agreement on the value of expanding Medicaid. There are questions about exactly how it will be done, but hospitals and many other advocates believe that Medicaid expansion is a great deal for the Commonwealth. First and most important expansion is going to make sure that 350,000 people who do not have insurance have access to insurance.
How many is that again?
350,000. Mm-hmm. And these are folks that are basically getting health care today, but they're getting it without anyone paying the freight. They can't afford it. And hospitals are picking up the tab. And in the Affordable Care Act, Obamacare, we made a bargain that if we would expand Medicaid and make sure that most Americans had health insurance, we would give up some federal payments that were helping to offset the cost. So we've already agreed to give up those federal payments. Okay. So now we want to see expansion happen so that we finish the deal.
Mm-hmm. Well, you've been on here for several months now, I guess since the beginning of the new year, and in this new position, what are your impressions of Pennsylvania?
We won't tell anybody.
I'm actually thrilled to be a part of this community. There is spectacular work happening in Pennsylvania, starting with just healthcare. The work our members, hospitals across the Commonwealth, and I'm talking from the large academic medical centers to the small 25-bed critical access hospitals, are working furiously to prepare for the healthcare delivery system of the future. People aren't going to be paying just to provide healthcare services. People are going to be paying to get good outcomes, to make sure people stay healthy. So our members are preparing for that, and they're improving the quality of care. They're investing in computer systems so that they can keep better track of patients and the kind of care they're receiving. So there's all that innovation happening. To your question on the political environment, I'm very encouraged that this environment is as curious and inquisitive about how we should shape healthcare for the future. From the governor's office to the Senate to the House, everybody is rolling up their sleeves to try to figure out how do we prepare for a future in which limited dollars have to provide and pay for even better health care. Mm-hmm. So that's dynamic and exciting. I'm glad I'm here.
Well, one of the things I've found most curious is that a lot of people are not really paying attention to the Affordable Care Act. And they think it's been, a lot of people think it's been repealed, which is kind of interesting. But, we're on the brink of employers and employees needing to start making choices and making decisions as soon as this fall. What is the Hospital Association doing from an education perspective,
Great
to
question.
let people know this is coming?
Great question, and more hospitals know that they will be a key resource to help Pennsylvanians make decisions. So we are working with our members to prepare them with information about where Pennsylvanians can go, where they can go on the websites to find information about making healthcare choices. Okay. So we're going to be training our frontline staff to make sure that they're an effective resource for Pennsylvanians.
Now, Pennsylvania is not doing a state exchange, right? So
Correct.
There's going to be a federal exchange and then probably numerous private exchanges available.
Exactly. I think it's causes a great deal of anxiety that we're relying on the federal government, which is not just around the corner.
Right.
But we intend to work with the Centers for Medicare and Medicaid Services to make sure we know all we can about the structure of the exchange. It's now
it's
in
a guessing
June.
game right now.
I'm afraid, Maureen, you're right. We are guessing. There has not been a great deal of information
Correct.
yet.
Yeah.
So instead of going on a nice summer vacation, I and my team and many hospitals are going to be working hard to prepare for that October 1 start date for the exchange so that we can be ready to help Pennsylvanians navigate their way to good health care coverage.
That's great. Great news.
Andy, in the news, we've heard reports of something called hospital assessments. Could you tell us a little bit about what is a hospital assessment and why is it important to your members?
Well, 3 years ago or so, we agreed to help the Commonwealth balance its budget. And we did it by agreeing, and I know this doesn't happen very often, but we agreed to a tax that we would pay for the purpose of bringing more federal money into the Commonwealth. And that tax did two things. One, it allowed the Commonwealth to do a better job paying hospitals for Medicaid. And second, it helped the government balance its budget. So it's a very important linchpin to healthcare finance and state funding for Pennsylvania.
Now, your third priority was to allow access for rural Pennsylvanians, and we haven't talked really about that. How is the Hospital Association working towards better access or more access?
We are supporting legislation that will make sure that critical access hospitals, and that's a fancy federal term for hospitals that are very small, 25 beds or fewer, that are in remote rural communities. Okay. And it's hard to deliver health care in those communities. It's expensive to do it. But they're doing a terrific job, but they're not getting paid the full cost of providing that care. Under the legislation we support, Medicaid would step up to the plate and make sure that they have the resources they need to make sure that Pennsylvania, which is one of the most rural states in the nation, if not still the most rural state, that all those rural residents have access to critically needed acute care.
How many of those hospitals do we have in Pennsylvania? Do you know?
We have something between 13 and 15 of those hospitals.
Probably all northern tier, mostly.
Well, yeah, they would be in the famous, and I have learned this as a new Pennsylvanian, they're mostly within the T.
Have you had the chance yet? Have you had enough time? There might not have been enough time in the day, but have you had the time to renew or to create new partnerships with the Pennsylvania Medical Society and the Nurses Association and the different...
I was going to ask if you fund every hospital yet.
Well, I'll tell you both. Yes to all the above. Without question, it's important that hospitals and the physician community remain strong partners for healthcare. So I've definitely been reaching out to them. The nursing community is very important in Pennsylvania and very important to the effective delivery of health care in hospitals. In terms of visiting hospitals, I've been all over the Commonwealth. I visited 70 so far.
Wow.
I still have over 100 and so to go. But it's very powerful experience to see what's happening in different communities. From Philadelphia to Pittsburgh, Scranton to Erie, and every place in between, you have real heroes working to deliver health care under excruciating pressure. Patient expectations are getting tougher and tougher. We demand a lot out of health care, and we're rising to the challenge. And as I said earlier, payers are demanding better results, better outcomes, fewer injuries to patients that happen in hospitals, and it's a lot of work to do, but we're prepared for it.
Well, we're so fortunate to have some of the most world-class health facilities in Pennsylvania. I don't think there's any way to dispute that because we really have some phenomenal places here. So.
You know, it's not just world-class famously in the larger urban centers. Those are distinctive contributors to Pennsylvania's healthcare system. But I don't want to lose sight of those smaller organizations that are also hitting really tough quality scores themselves. I mean, you can go to hospitals in this Commonwealth with a high degree of confidence that the best care is going to be provided to you in a cost-effective way. And many states can't do that. I'm pretty proud to be a part of a state that can make those kinds of claims.
Mm-hmm. What would an ordinary visit to a hospital be like for you? Say you're just visiting one of your member hospitals for the first time. How would that day unfold, Andy?
Two things I like to accomplish on a visit to a hospital, and anyone should try to do this that wants to learn more. One is you meet with a leadership team to find out what their strategic vision is for the next few years, the investments they're making, and how they're responding to consumer preferences for new kinds of care and different care. Then you have to start walking the halls and meeting all the staff, meeting the clinical staff, the nurses, the rad techs, the med techs, anyone providing care, and find out what's going on the floors. And I've been thrilled to see the level of energy that people are bringing. I had fun learning that there are simulation labs being built in some of our hospitals where clinical workers are discovering what new ways to work on patients without actually working on a live patient, but working on a very sophisticated computer-operated dummy that has real heartbeat going, or simulated heartbeat, simulated blood pressure, simulated neurowaves in their brain, so that they can practice figuring out what to do when something bad happens, for example. So it's that kind of innovation that's happening around the Commonwealth that's very encouraging to see.
Mm-hmm.
Well, I know we're running out of time here, and so we may only have the ability to answer very briefly on this one, so we might need to have you back. But Health and Human Services released a report recently on the disparate charges between different hospitals for different procedures, with huge differences between what one hospital versus another. That came out, I imagine you got a lot of inquiries about that in Pennsylvania. Are you addressing that in some manner, or are you just
well, job one is to understand the disparities.
Right.
And I'd say it is a good topic for a future discussion. I will leave you with this. There's no question that what's called hospital prices that are published, there are a lot of very complex drivers behind those prices. And we are working as a hospital community to do a better job explaining those prices to consumers, to the general public, so that they can make informed decisions about whether that price matches the value of what they're getting and what they can do based on the conclusions that they make. We clearly have a lot of work to do to make it clearer and easier for people to understand.
Good.
I guess you're working with the insurance companies as well on that.
They're absolutely key partners, Charlie. You're right.
So. Okay. We will be back with Mr. Carter at a future date, and we hope that you'll return as well, and we'll look for you next week again here on Behind the Headlines. See you then.